Hey everyone, welcome back to Static Cardiology here on EMTV. I'll be giving you an ECG rhythm and a scenario. On the bottom of the screen you'll see a timer for 1 minute and 30 seconds. This time closely resembles the average amount of time you'll want to be spending on each card during an actual National Registry exam. When the time is up, we'll go over the rhythm and I'll give you my treatment. Enjoy the card and good luck.
3, 2, 1.
For many of you, this scenario should have been a really good review. Let's go ahead and take a look at the rhythm in a little bit closer detail. The first thing I like to do with any rhythm is count the rate. I'm counting 19 R waves, which means this patient's heart rate is about 190 BPM. The next thing I'll do is take a look at my R to R interval. My R to R interval is nice and regular. And by measuring the QRS complex, I can see that it's narrow. When I examine the spot between the QRS complexes, I cannot make out the difference between a P and a T wave. This characteristic is extremely important when identifying certain cardiac rhythms. The last thing you may have noticed here is the alternating height of the QRS complexes. This phenomenon is known as QRS alternans. QRS alternans is often associated with individuals suffering from an acute pericardial effusion or a cardiac tamponade. But because the information in the scenario does not mention any sort of chest trauma or significant underlying history, this may not be the cause. QRS alternans can also be seen in patients suffering from orthodromic atrioventricular reentrant tachycardias, which are considered a form of SVT. Based on the characteristics of this patient's rhythm, the regularity, the narrow QRS complex, and the inability to determine the difference between a P and a T wave, my diagnosis of this rhythm is going to be supraventricular tachycardia, or SVT, and is very likely an orthodromic atrioventricular reentrant tachycardia. Now, let's go ahead and take a look at the scenario. You were dispatched to a local gym for a 32-year-old male who has collapsed. Upon arrival, you find your patient unconscious, lying supine on the ground, surrounded by onlookers. A staff member reports that the patient had just finished lifting weights, placed them on the floor, and then lost consciousness. Your patient appears pale, is breathing spontaneously, and has a rapid carotid pulse. Physical exam reveals no significant findings, and the patient withdraws to painful stimuli. Your partner obtains the following vital signs: blood pressure 72/44, pulse 190, respirations 14, SpO2 90% on room air, and a blood sugar of 101. You attach the monitor and see the ECG above. To be successful in static cardiology, not only do you have to diagnose the rhythm correctly, but you must decide whether or not it is stable or unstable and choose the correct treatment algorithm. For unstable criteria, I use the acronym CHAD. And this, of course, stands for cardiac insufficiency, hypotension, altered mental status, and dyspnea. Based on my patient's physical presentation, as well as his vital signs, he's altered and hypotensive. My final diagnosis for static cardiology is an unstable SVT. Now, let's go ahead and move on to the treatment. Just like with all my other cards, I'll begin treatment by regurgitating the mantra: Scene safe, BSI, IV O2 monitor. Now, because we've determined this patient is unstable, and unstable gets the cables, I'll be performing a synchronized cardioversion. If this patient were alert, I would consider sedation, but because he is only withdrawing to painful stimuli, he is considered adequately sedated. I'll attach defibrillation pads to my patient's chest and press the sync button. I'll then select an energy starting at 100 joules. I'll then press charge, and then when ready, I'll press and hold the shock button to deliver the energy. I'll repeat synchronized cardioversion in this fashion up to a maximum energy setting of 360 joules or until I get conversion. Because this patient is also hypotensive, I could consider administering IV fluids and even performing airway management. And finally, rapid transport. And that's it. If you enjoyed this card, please make sure to head over to my channel for more. And while you're there, make sure you check out my other videos and subscribe to my channel. I also have a store on Teespring. Make sure you head over there and check out some of the shirts I have, like this new one called Shock Advised. Until I see you next time, stay safe, keep washing your hands, and have a good rest of your night.